Hi, I'm Lindsay. I'm an art therapist and EMDR therapist, and I integrate the two into my approach. Art therapy is a way for the children, young people I work with, to express themselves, to regulate themselves, and to allow the unconscious processes to come through in the work. So it's really good for trauma work, so working through that trauma. And then I bring in the EMDR just to kind of follow the child, young person's creative process. So EMDR uses bilateral stimulation to kind of kickstart the brain to do its natural healing. So when the trauma gets stuck, and the bilateral stimulation allows things to just be worked through, and as I said, it's natural healing. Bilateral stimulation simply means to activate the left and right side of the brain. And we do that really simply through tapping. So this is the butterfly hug. So we're just stimulating the left and right side of the body, and this gets things going, gets things moving and processing. Or we sometimes tap the legs, or we can tap feet. Sometimes we use art making, some bilateral stimulation through using the hands. And that can be used as part of the stabilisation process of therapy and as part of the trauma processing. How I sort of weave the EMDR into the art therapy is to follow the creative process of the child, the young person, and just kind of take opportunities. So thinking about their resources, we can strengthen their inner resources by thinking about their support network. So this can be real and imaginary. So it might be friends and family, and just kind of thinking about the felt sense of them, and just get them to kind of tap that through as that comes up in their therapy to strengthen that inner resource. So imagination is a really powerful tool to really strengthen those resources in the child. And when it comes to the trauma processing, I quite like using EMDR buzzers. So these are two pads that do vibration into each side, so you can hold them. But what I quite like to do is to put it in the children's socks, so they've got their hands free to kind of, to be creative in whatever way they choose. So really kind of just, again, following their process and using the bilateral stimulation to process things further. So in my work, we can do that through art making, we can do that through creative writing. Sometimes we do like a therapeutic letter. So when there's kind of complex feelings towards a particular person about their trauma story, sometimes it's difficult to kind of connect with anger or certain feelings, and the therapeutic letter writing with the bilateral stimulation can really help them to do that. Some feelings are quite resisted, so we kind of do lots of work with the body as well. So again, with the example of anger, if someone's quite fearful of their anger or struggles to connect with it, or it's just kind of it's not being processed, going round and round, I can get them to do something with their body. So I have an apron in my room, so they can kind of twist the apron, and then the buzzers, or do the and then it just starts working that processing through that anger. You can also do that with the art making as well. So with anger, it could be scribbling, or kind of activating the fight responses, this kind of movement with the art making. And the sense of kind of relief and amazement that the child has afterwards is really incredible, that they've worked something through, they've felt this big relief. Thank you.